he felt these doctors should be paid. That's for you to decide. So the CPT, by the way, I've got his name here. James Adamson, that's the Blue Cross Blue Shield Association's member who sits on the board. Michael Beebe is the secretary of the CPT editorial panel, and he's also the director of CPT for the director for the AMA on CPT codes. Defense expert didn't like what he had to say. Remember that? Oh, well, Mr. Beebe, he's just a staff person. No, he's the director of the AMA on CPTs. No, he's not. Then I read it in the deposition. Okay, well, maybe he is. He's the secretary of the editorial panel. Oh. And I asked him, what is the opinion of the CPT editorial panel, where Blue Cross Blue Shield Association has a member, and the AMA, on whether these doctors should be paid the professional component of clinical pathology services and be paid a fair price? Answer? Well, yeah. They have to be paid. It has to be covered. It's a necessary service. They also have an assistant, Claudia Bonnell, Blue Cross Blue Shield Association, that works in the CPT editorial panel. And she's even thanked for all her hard work. What is the AMA's position on it? Policy reasoning. Business decision. Remember that when they said it's a business decision? Did you take into consideration the AMA's position that doctors should be paid their professional fees directly? Did you take into consideration, remember the one about Medicaid? Medicaid pays the professional fee to the doctors? Well, we're going to ignore all that. You know why? Because that would mean they can't keep $4.1 million. This CPT article from the AMA specifically says that, remember when I told you about the technical component? The hospital builds the technical component. The pathologists are owed directly the professional component. It's all clear. It's all in the documents, and it's all very powerful. Professional component billing is one valid method of billing for the professional services of pathologists in the clinical laboratory. And not according to Blue Cross Blue Shield. Not according to Health Options. Here's the document that said they were going to, what they would do is they would not pay the doctors, and then they were going to pay the hospitals, but they changed their mind and decided they weren't going to do that. They were just not going to pay anybody. You'll have all these documents. You'll have the one about Medicaid. They asked Medicaid, are you paying the professional component to the doctors? Yeah, we're paying. You'll have this one. We need to change our contracts to say that the hospitals are responsible for paying. They didn't do it. You'll have this one. You know, about half of the plans that are at the Chicago meeting, the Blues plans, they're paying the professional component in their respective states. What should we do? We're not going to pay it. What's the result of that, folks? Well, in this particular group, Dr. Gonzalez, which was one of the partners at Palmetto Pathology, he left to go to a state, New Jersey, where they are paying the professional component of clinical pathology. They lost a partner. And as a result of that, Dr. Abels, who was planning on retiring, he's 65 years old, is now back working 10 months a year, 9 to 10 months a year, as opposed to working part-time. And he's now the managing partner. And they haven't been able to replace Dr. Gonzalez, who left, because he's not being fairly paid for half of his practice. The pathology group's not being paid for half of their practice. Why? Blue Cross Blue Shield document. This decision is expected to produce a projected annual savings of $4.1 million for Blue Cross Blue Shield Florida Health Options. Does it say savings to the members, to the subscribers? It doesn't say that. It says Blue Cross Blue Shield South Florida. And then they talk about what the delay is. Well, it means we won't be able to save $4.1 million. In the documents. What's the risk? What's the risk of not paying fair rates? What's the price healthcare has to pay? Consider that in determining what a fair and reasonable price is. We know that in 1991, there was a sheet, a rate sheet, for what the defendant was paying for the professional component of clinical pathology. 1991. The defendant admits, as you can recall, that the medical inflation is 12 to 14% per year compounded. Compounded. Remember, I did the analysis. If I have glasses and it's a healthcare issue, my glasses aren't a healthcare issue, but as an example, if it's $10 the next year, it goes $1.40 more, so it's $11.40. And then the next year it's 14% more of $11.40, and it compounds and compounds year after year after year. From 1991, what are those rates in 2006? Compounding every year, 14%, 14%, 14%, 14%, 14% for 15 years. A lot. That's why there's a difference between what was, in 1991, a $3 professional component charge to what, in 2006, is a $10 charge. Keeps up with the inflation rate for medical services. It's fair, it's reasonable, it's usual, customary. You heard that from Dr. Hausner, a medical doctor. You heard it from Dr. Abels. You didn't hear even the economists tell you that the rates, think about it. Did the economist say his rates were unfair? No. Did he say they were not usual and customary? No. Did he say they were not reasonable and necessary? No. What did he say? We don't want to pay them at all. But they provided no testimony, no evidence whatsoever that the billings were unfair. HOI's own document says, you take the risk, doctor. We don't stand behind you. If you get sued for malpractice, you got sued for malpractice. Too bad, not HOI, not Blue Cross Blue Shield. We won't pay you, and if you get sued, we won't stand behind you. You're on your own. So what are the, can we go to this last page, please? You'll have an instruction from the judge on what the fees are, what you should be considering in awarding your fees, and it has to be reasonable fees for the work that they've done. And the testimony in this particular case is very simple. From March 1, 2001 to December 31, 2006, we have the total amount of the professional component of clinical pathology fees that were billed. They were usual and customary, reasonable and necessary for this South Florida market. The court's also going to instruct you that statutory interest is required, initially at 10% and then at 12%. That's why we had Mr. Bolano, the accountant, come in and calculate the interest. And it's simple interest. Simple interest. And what that comes up to, under Ms. Ruff's amount, for the billings that were not challenged by the defendant, not contested, it's uncontested, $1,032,219 in billings for the professional component of clinical pathology services. Now the defendant will argue, we got this late. Well, folks, they've had these billings since 2001. 2002 billings, 2003 billings, 2004 billings, 2005, 2006. Not once did they say they were not reasonable. Never. They just didn't pay them. And in this litigation, they got a rate sheet first that was higher because it had another hospital billings in it that Dr. Abels worked at. It's Cedars. We asked them to take Cedars out, and there were mistakes initially that had anatomical that they weren't paid for. But we took things out that the defendant didn't have to pay, and then now they're going to come in and complain, well, you took things out. The number went down by over $100,000 as a result of doing that. Not up. So the amount is $1,132,219 for the professional component of clinical pathology services provided to the defendant's subscribers at Palmetto Hospital and Coral Gables Hospital only. The statutory interest that was calculated at the 10% and then the 12% for the relevant years, and the court will instruct you on that, is $414,260. That's the second column. Combining both the interest and the principal, the total balance and the total amount owed that is reasonable, usual, and customary in this case for the professional